Gareth. I'm a psychiatrist and medical director working in the UK, and I'm making a series of videos about open dialogue, the transparent, inclusive approach to mental health care, and all my learning about that over the last 10 years. Today I'm going to make a video about the first of the 7 principles of open dialogue, and that is immediate help. Let's think about that moment when somebody first reaches out for help. That takes a lot. Whether it's the person themselves or the people around them, it's often been a complex and sometimes very long journey to get to that point. But whatever the route is to that point of reaching out for help, there's usually a desire for change at that moment. There's often a deep meaning at those moments where issues have come to the surface and we feel more connected with them at that point. So often there's a lot to discuss and an opportunity at that point to connect with some of those things that have needed to be said and perhaps the conversations that haven't been able to happen up until this point. There's also a vulnerability in asking for help. It's a difficult thing to do, and we need to honour that and make sure that we are respecting that somebody has built themselves up to the point where they are reaching out, asking for a change, and for somebody to support them. And one of the things we can do at that moment to really help build trust is to be really timely in the way that we respond. This is what the team in Tournai found as they started to develop up the open dialogue approach. They found the more that they tried to minimise any delays in getting to somebody as they were working with them during their mental health crisis, that they would be more able to include people who are important to that person, but also to find that they were getting a more trusting relationship and dialogue flowed more naturally at those points. I found it as well in my own experience. I've worked as a consultant psychiatrist for many years in a mental health crisis team in the UK. And as part of that, we developed our open dialogue practice and took part in a large open dialogue research trial. We found that as a team, when we were minimising the delays and getting to somebody as quickly as possible, that there was an opportunity for a more trusting connection to be built between us and the people we were trying to help. We also found that we were able to include people who are important to them more at that point. They're more likely to have the energy and the interest at that point to want something to change and to be around somebody. So in trying to achieve that golden thread goal of open dialogue, of trying to include others, you're more likely to do that if you respond in a timely way. And we also found that in getting to somebody at that point where they had that energy for change, that momentum could be maintained through the conversations that we were having, and it would build towards a meaningful change for that person being able to occur. One of the questions I often get asked at this point is, how can you actually have the resources to meet somebody as quickly as that? Well, it was really about rearranging what we already had and making sure we were prioritising the timely response. In meeting with people quickly and gathering a network meeting together, we often found that people felt more contained by the quality of the conversation that we were having, and people have always, I found, been respectful of the limited resources we have available. And they would often say at the end of a session, when we would be asking, when should we meet again? It would often be, well, maybe about a week's time. And that was often enough, knowing that next meeting would be coming. And indeed, we often found that people felt that they needed time to process what we'd been discussing within those conversations. So there is an opportunity for us to reprioritise our services to make sure that a timely response is considered to be one of the most important things that we can be achieving, making sure that we use the energy of the moment for momentum for change, to be inclusive of the people who are important to that person, and to use that to build conversations that can be meaningful and lead to better recovery. I'm going to carry on making these videos. There are 6 more principles that I need to describe. Please subscribe to the channel, give me your questions in the chat, and I hope to see you next time. Thank you.